In 2016, Penn Live published Failing the Frail, a 6-part investigative series that explored major problems in Pennsylvania's nursing home industry, including the death of 46 residents. That investigation was prompted in part by a 2015 lawsuit filed by Pennsylvania's Attorney General against Golden Living and other nursing home chains in Pennsylvania. 3 years after the lawsuit and 2 years after the publication of Failing the Frail, Penn Live wanted to use Golden Living's nursing homes as a lens to re-examine the state of Pennsylvania's nursing home industry. We're going to talk about that series today with Ron Southwick, who is the managing producer of Still Failing the Frail project at Penn Live. Mr. Southwick, welcome to the program.
Good morning.
Here, let me get the right microphone. There you go.
Okay.
If you have a question or comment, 1-800-729-7532. Send an email to smarttalk@witf.org, or on Twitter, we are at smarttalkwitf. Again, that phone number, 1-800-729-7532. All right, I remember the original series 3 years ago. We had the reporter on the program talking about it. Why the need to update it, and what did you find in the 3 years since the original series?
Okay, well, we wanted to look at this nursing homes that were formerly managed by Golden Living. We wanted to take a fresh look. It was actually 3 years after the lawsuit that was filed by then Attorney General Kathleen Kane. And
who's going to jail tomorrow, by
exactly,
the way.
yeah. So, but she did something that really was kind of groundbreaking in filing this lawsuit against Golden Living, alleging poor care at these nursing homes. It really kickstarted a bunch of changes and at least promises for change at the state level to improve nursing home care around the state. So 2 years after our initial series, Failing the Frail, we wanted to look back at how some of these homes that had been formerly managed by Golden Living, see if they'd gotten any better. We'd heard from some residents or some family members of residents that things were not to their liking. So we took an exhaustive look over the course of 8 months, looking at state inspection records, talking to various numbers of families, staffers, and also advocates for seniors. We basically found out, at least looking at these homes that are formerly managed by Golden Living, that in most cases care had not improved, and in some cases had gotten worse. Golden Living had managed 36 nursing homes in Pennsylvania. Our examination found that 22 of those 36 nursing homes had as many or more citations than they had under Golden Living. Staffing in most of those nursing homes also was the same or had gotten worse, looking at state records as well. And we've talked to a number of advocates and people who look at the nursing home industry, said that's sort of a common theme that happens across the nursing home industry. A lot of homes that just are perpetually challenged, often stay challenged, especially if they get sold from time to time. And there's a number of factors at play here. Some nursing home operators will say, and they have merit in saying this, that funding is not what it should be.
Funding from who?
Funding from federal and state governments.
Medicaid and Medicare.
Medicaid and Medicare. Now, Medicare, run by the federal government, typically covers short-term care. Like, say, if somebody has a broken hip and they're maybe in a nursing home for a few weeks for rehabilitation purposes to get back on their feet a little bit, Medicare would sort of cover that. Now, for longer term, say, like maybe for months or an indefinite stay, that would typically be covered under Medicaid, and that's a program run by the states. And a lot of nursing home operators in Pennsylvania and advocates for seniors as well would say that Medicaid funding is not what it should be. So there are certain truths when nursing home operators say funding is challenged for these facilities.
So staffing has always seemed to be an issue. Mm-hmm. Talk about in your investigation, and from what the government says, what the industry says, of what is adequate staffing, and at some of these homes where it is not occurring. I know it goes by hours. It's kind of complicated to understand, but can you explain that?
It gets a little complicated to explain sort of quickly and sort of soundbite form, but yeah, there's a lot of care, a lot of advocates that talk about the level of care, and some talk about like number of hours per care per resident, so that each resident should get on average sort of about 4 hours direct care is what some advocates would say per day. Yes. So now that can vary depending on the sickness of the individual involved. If somebody needs more care or less care, some people, but they're saying on average residents should be getting 4 hours per day. Now it's worth noting that Pennsylvania's minimum requirements is not 4 hours. It's a little bit lower than that. And some advocates say that Pennsylvania needs to improve its staffing requirements, and that's something that advocates have said that Pennsylvania. That'd be one step Pennsylvania could do to improve the quality of care of nursing home residents, is to boost the minimum staffing requirements.
How is that measured, though? I mean, because I have to say, and I've mentioned this on the air before, my mother is a resident of a nursing home. And, and I'm just picturing when a CNA or a nurse or a staff member is in, it's not 4 solid hours or 2 solid hours. It's, lunchtime.
And we're talking about averages, of course, like the average course of a day. Because sometimes they're in for, maybe for intensive therapy. Sometimes they're there to change a dressing or to reposition a patient, depending if it's a resident that maybe is largely confined to the bed, and so they have to reposition them and avoid bed sores and stuff like that. So it's not 4 hours of a block of time, but it's over the course of a day that they're. The advocates would say that 4 hours would be a better barometer for, helping ensure the care of these residents.
All right, so staffing is an issue, but what does that lead to? What are some of the citations that you're talking about? What are some of the issues that we're dealing with here?
In our investigation, we found a number of different issues ranging from quality of care to, cleanliness issues in some of the facilities, in some cases, residents that fell. There was one particular instance we found in a Cumberland County facility where there was a resident that had some issues and had assaulted another resident, and that this facility was actually cited by the state for not doing enough to make sure that this didn't happen, but then also didn't report it properly as well. Mm-hmm. So there's a number of supervisory issues that have related directly to quality of care. Again, a lot of these tend to relate to staffing. That's sort of the one thing we found at a lot of these nursing homes. I think when we looked at the series, and we looked again, the series focused largely on the homes that were formerly run by Golden Living. So 36 of those 36 homes we looked at, about 31 of them, staffing was the same or had gotten worse over the period of 2 years.
Since the new company took over.
Since the takeover.
Who is the new company?
There's 4 companies that have actually took over the Golden Living homes. Priority Healthcare has taken ownership of 11 nursing home licenses of those 36, including several that are here in central Pennsylvania. Skyline Healthcare had acquired 7 of those licenses. That's a company that actually is an interesting case to talk about, because this is where advocates say the state needs to be doing a little bit better job vetting nursing home owners. Skyline was one of the companies that bought homes that were formerly run by Golden Living. About a year later, after the State Department of Health had given them approval to get those licenses, Skyline, citing a bunch of financial difficulties, basically abandoned its nursing homes, and Pennsylvania, along with other states, had to take emergency control of those facilities to make sure they were getting care, and then they had to move to find new owners for some of those nursing homes. So critics really looked at the Skyline case as an interesting example of, where the state needs to be doing a little bit better job of vetting, because a year after getting licenses, they basically got out of the nursing home business. They're saying, well, if their finances were that precarious, at least according to what advocates say, maybe the state should have been looking and doing a little better job to make sure they were up to the task of running nursing homes.
How many nursing homes are there in Pennsylvania?
I actually don't have the exact number, but there's 90,000 nursing home residents across the state.
Well, the reason I asked that question is because we're looking into the former Golden Living cases. Yeah. Is it fair to say then that the industry itself is having these kind of problems, or is it just this one group of homes that were owned by this one company?
Advocates would certainly say this is a challenge across the industry for a number of reasons. Nursing home operators would say with some merit that, funding is an issue, because funding helps dictate the level of staffing that they can provide. If they get less funding than they would like from Medicaid, that does make it harder to hire not just nurses, but registered nurses and LPNs, and the nurses are really good quality nurses who have experience and can take care of people too. But advocates say that this is a problem that's really emblematic of the industry, and it's a problem that's going to get worse because, as we all know, America's got a growing senior population. You're going to be seeing more and more people probably heading to nursing homes. So this is something that there's no easy magic silver bullet solution, but it's something that policyholders, elected officials are going to have to address as the population gets older.
Someone we heard from this morning is Eric Keel, who was the Director of Communications and Public Affairs with the Pennsylvania Healthcare Association. Mr. Keel, are you there? Mr. Keel?
Yeah, hi, Scott.
Hi, how are you?
This is Russ McDaid, the President and CEO of Pennsylvania Healthcare Association.
Okay. All right. So we were contacted by your communications office, and you, first of all, tell us what the Pennsylvania Healthcare Association is, who you represent.
Yeah, first I want to thank you for having us on to provide another perspective on this. We represent roughly 300 nursing facilities statewide here in Pennsylvania, and there are currently 699 to answer the prior question. And what we do on their behalf is work here in and around both the state and federal governments to ensure that they have the tools that they need, both financial tools and human resources, as well as the regulatory climate that they need to ensure that they can do what their number one focus is, and that's provide the highest quality of resident care that they can each and every day to the folks in their nursing homes.
Now, do you represent for-profit or non-profit nursing homes?
We represent both. We primarily represent the privately held or investor-owned folks, but we do represent both for-profit and not-for-profit nursing homes. There really isn't a significant difference based on that status. The difference comes when you look at the level of Medicaid that they care for, and that's really kind of when you start to drill down in this. It's that Medicaid funding. And the inadequacy of that Medicaid funding on covering the facility's cost on a daily basis that really we believe is one of the key roots to the challenges that everyone is seeing.
And we want
and the for-profit facilities have more than 70%, almost 75% of their average residents on Medicaid, where a not-for-profit would have just under 60. So, that kind of gives you a sense, Scott.
All right. Well, you say there's not a big difference, and you're right when you talk about those percentages of patients that, it's being funded by Medicaid. But the big difference is that a for-profit facility, that the goal is to make money there, to make a profit, as compared to a nonprofit. So I know that one of the things that was touched on in this series is that there were cutbacks in staffing, cutbacks in other areas, so that profits could be increased.
Yeah. Well, first, I got to share that. Look, no business, whether you're a healthcare facility or a hardware store, stays in business if you're not earning a, quote, profit. So the belief that not-for-profits don't have to earn a positive margin is just inaccurate. They're not in the business of losing money. Everybody's got to earn a margin, to stay open. And, the finances of the sector are different on one side or the other. The challenge that they both face is that here in Pennsylvania, our state Medicaid program is paying them almost $50 a day less than their actual cost of care say they should be paid. And that math works out to $17,750, almost $18,000 a year per Medicaid resident. And you multiply that times a facility with 100 Medicaid residents, and that is a $1.8 million a year hit. And you can't make that up when you're losing that much money on your core line of business on volume, which means as a facility, you're forced, unfortunately, to put every dollar that you can at the resident bedside. You're forced to invest to the extent that you can in your staff, but there's only so far you can go with underfunding when you're so heavily dependent on Medicaid funding.
But the difference is, now, I think, and I don't want to get into a philosophical discussion of for-profit, nonprofit. One of the differences here in your industry is that people's lives are at stake. People's health is at stake. And if you do have to make those cuts at the bedside, that staffing has to be cut, or maybe some other areas have to be reduced, people's lives are impacted by that. How do your members make that decision to make sure that those residents are still getting quality care, even though there is a motivation to maximize profits, or at least to be profitable?
Yeah, and that's their number one priority, Scott. And you both touched on it a little earlier. We have a state staffing standard here in Pennsylvania in our regulations. It's 2.7 nursing hours per resident day, and the federal government is now looking at this themselves. And in the data, statewide Pennsylvania data from the first quarter of 2018, so that would have been earlier this year. That's the most recent data available. The Pennsylvania statewide average is 3.81 hours per nursing day, far exceeding that state minimum. You also noted, appropriately, by the way, Ron noted, that that is dependent on the acuity of the individual. So lower acuity folks, if you've got a facility where people have less needs, and don't have as many co-occurring healthcare needs or aren't as severely compromised, your staffing level would change versus a facility where they are. Now, our folks put every resource that they can towards their resident, and towards the resident care. One of the highest costs in healthcare and long-term care, it's hitting us straight between the eyes right now, is staff turnover. Because if it's difficult work, it's awful thankless work, and if you can't pay people the wage that, say, the Sheets or the Wawa down the street can, and they can go make $2 or $3 more an hour down there for work where it's far less challenging, both emotionally and oftentimes physically. We just can't compete. So we're having a hard time holding on to our best and brightest. And it's high stress work. There's always going to be some turnover anyway, because this is for people who are truly compassionate and dedicated to caring for the seniors.
Hey, Mr. McDaid, I'm glad that we had an opportunity to talk, and I'm going to make this. We've been talking with the organization in the past about getting someone on the program. And I'm saying right now we need to do that and talk about this a little bit more. So I'm running out of time for this portion, but there's an invitation out there, and we will get in touch and schedule something, okay?
Absolutely.
All right. Thank you very much. But Ron Southwick, let me get back to, you heard what Russ McDaid had to say. And by the way, this is Penn Live. By the way, you also can see this on papost.org, the series of stories which are very well done, very well investigated, not supposed to be one-sided. You did talk to the Pennsylvania Healthcare Association, a lot of other people involved in the industry. But your reaction to what he just had to say?
He raises. He makes very valid points. In terms of the Medicaid funding, most advocates for seniors and nursing home operators would agree that Medicaid funding is a serious challenge in terms of staffing.
Most? How about all?
Yeah, I would tend to think yes. Yeah, I always try to qualify a little bit. I try to be careful as journalists.
You may get that 1% say, we're okay.
Yes, there's that 1%. Yes, but yes, pretty much everybody agrees staffing is going to be a serious issue as long as Medicaid funding is not really addressed, and that's something that policymakers are going to have to look at.
We only have 3 minutes left, and I do want to touch on this, and I will vow that we will talk more about this in a future program. The state's role in this. Mm-hmm. 3 years ago, one of the things that you investigated, Penn Live investigated, was whether there were inspections taking place as they were supposed to, when they were scheduled to. 3 years since, has there been any improvement in the state role?
I think advocates would say that's sort of mixed at best in terms of oversight, and I think that's going to be really interesting because the same day we published our series, a few hours later, the State Auditor General, Eugene DePasquale, put out a statement and said he's going to begin another audit of the Department of Health's oversight of nursing homes and trying to look at their oversight and look at how the health department is looking to make sure that nursing homes are doing their job. So I think what advocates, where the frustration comes with the Department of Health is in terms of the not so much even the amount of inspections, but when inspections find something that there's relatively few penalties. I think we found in the series about looking at the homes we examined, 100 citations that were spotted by, say, 100 instances where inspections led to citations. About only 10 of those actually led to a penalty of some kind in terms of a financial penalty. So there are some people, advocates especially, who say the State Department of Health can be doing more to be a little bit tougher to coax homes into improving more.
Did the Auditor General do an audit on? The
Auditor General did an audit in 2016, and he highlighted some areas for improvement. And in the course of that, initially the Department of Health apparently. The Auditor General credited the Health Department for making some changes in terms of being more transparent in how it was overseeing nursing homes and inspections and such like that. What the Auditor General said just a couple of weeks ago, after we published our series, that he wants to take another look to see if the Health Department is continuing to make progress in its oversight. So.
Ron Southwick, obviously there is a lot to talk about here that we can't just cover in a half hour on the air. You have a 6-part series. You can see it on PennLive.com. It's also on papost.org. Want to thank you very much for being with us today.
Yeah. Could I pimp something real quick just
Sure.
to help? Because I know, you mentioned, I know your mom's been in a facility. My dad was in a facility. Look at PennLive.com for tips on how to find a good nursing home.
That's one of the things I wanted to ask about.
Yes.
And you have a database of all the homes in the state and how they're rated, correct?
Correct.
Okay. So very valuable tool right there. One of the things that we should talk about another time is how do you actually do it, because many people are thrown into the situation very quickly. Ron, thank you very much for being with us today.
Thank you.